safe and friendly. Most of the people of Kasese were at around 4 a.m. today morning in the village of, that is Kasika village in Rukoki sub-county Kasese. There were mudslides, and we are told a few people are missing and a few homesteads have been buried. However, the Uganda Red Cross, we want to commend them for the good job. They have dispatched a team to carry out rescue missions there to see how many people can be rescued. We stand and we pray for them, and we hope that all efforts to save and rescue lives will bear fruit. We continue to also urge Ugandans that let's be mindful of our human activities, because some of these floods, some of these are a result of human activity. But by and large, we should all be very conscious. It is rainy season and so much is happening. Well, away from that, it is Good Morning Uganda agenda, and here you're able to be part of the topic of discussion by simply going to our social media platforms and contribute to the matter at hand. This morning, we are going to be discussing cancer treatment in Uganda, but to be more specific, are care homes that have been introduced at the Uganda Cancer Institute. And joining me on set to discuss this is Dr. Jackson Oriem, who happens to be the Executive Director of the Uganda Cancer Institute, one that has emerged as the Center of Excellency in the East African region. Doctor, you're most welcome.
Thank you, Robert, and good morning, viewers.
Well, I want to first start by commending you, Doctor, and the team, because I know you don't do this alone, that when I was trying to read through, prepare for this show, study more about cancer, I discovered that Uganda, we have the Center of Excellency in East Africa.
True. Actually, to be more specific, Uganda has actually been in the leadership in as far as cancer care is concerned in the whole of Africa, because our center here in Kampala started in 1967, and it started as a research center because around that time a new cancer was discovered in Uganda, the first of its kind in the whole world, called Burkitt's lymphoma. And because of that, the focus of the whole world was here in Uganda to understand that type of cancer, because it had a lot of premises. First of all, it was known to be fast-growing and also very responsive to new treatment that was being tested around that time, called chemotherapy. In those days, actually, there were only two ways of treating cancer. You either cut it off, surgery, or you radiate it using radiotherapy. Chemotherapy, as we know it, that is the administration of drugs or taking of medicine to treat cancer, was still very new. So to discover that there is a cancer somewhere in the world that is actually responsive to that new type of treatment meant that everybody packed their bags and they were hiding to Uganda, the place where the theater for this new discovery was. So that is the background.
But of course, thanks for keeping things moving to that. Now, Doctor, when you talk about cancer, to someone watching us, the number of diseases, help us understand, what is cancer?
That is actually a million-dollar question. Cancer refers to some type of diseases that usually manifest by, first of all, rapid growing, and then lack of control of body mechanism of cells within the body. And that actually eventually grows into masses and can also spread to other parts of the body. So unlike infection or viruses, bacteria, etc., cancer is part and parcel of the body, the cells of the body that has actually gone out of control. So that means it's part of you. Yeah.
Now, that would also bring to us understanding if there is a cause of cancer. Because most of the times I've spoken to many doctors and they tell you they seem not to give a clear cause of cancer. What is the cause of cancer?
That is also a very good point, a very good question. The reason why cancer comes about is because in our body we have the control of cells through what we call DNA. And it is a well-integrated system that controls itself. But when that system breaks down and there is loss of that control because of derangement of the DNA, then cancer actually is said to have occurred. So that is why actually to kind of specifically say there's a cause is very, very difficult. But there are factors that we call risk factors that usually potentiate the derangement of the DNA that eventually actually leads to the development of cancer.
And what are those factors maybe that we can avoid?
A very good point as well. These factors can range from things like, for instance, infection, like the viruses, and then environmental factors, like, for instance, radiation, and then at times also actually our own lifestyle, because of the foods we eat and all that kind of thing. Those are the factors that contribute to development of cancer.
Now, doctor, also there's one thing that I want us to know. How deep is the cancer problem in Uganda? Recently, I was discussing with a number of friends of mine, and they were telling me, Robert, it seems cancer is very, very common these days. And I asked them, I said, look at most of the big shots dying today. Many of them, actually, I earlier told you, you'll hear the medical team led by Dr. Jackson Oliem is coming to give us a report. They're saying, cancer, 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 cancer. You know, this brings us to understand, should we have so much concern? Is it, if we are to look at diseases that kill Ugandans today, where is cancer standing in terms of graveness or commonness in people?
That's a fundamental point that you have made. The reason is just very simple. I think we have overlooked a problem for a very long time. As you know, even our health system is structured towards what we call communicable diseases. But we have overlooked the non-communicable diseases. That is actually the biggest monster that now we do have. So the reason why you, me, and others should be very concerned about cancer is because it is unlikely that you, Robert, you are going to die of tuberculosis. It's unlikely that you are going to die of malaria. So the most likely cause of death for you and me, who have actually emerged out of all the threats of the communicable diseases, is going to be the non-communicable diseases. And the captain of all this is actually cancer. So we need, as a government, as a people, to be concerned about it. There are many ways we can actually put in place to control this. But at the moment, our system is structured such that we are actually not focusing on that. And that's the reason why you'll find that, you know, most of the people of worth are actually dying of cancer.
Now, that brings me to dive deeper into the topic of today, which is the care homes that were introduced. When I watched this tent, some media saw care home, and I'm like, but there are admissions at the Uganda Cancer Institute. Why then are we seeing a tent outside the institute and we are seeing people there? What is the reason that has driven the Uganda Cancer Institute to introduce the care home at the institute? Yet it also admits patients. Yeah,
so as you know, in every system, when you are trying to have something to do about a problem, you need to kind of understand what are some of the factors that maybe is making you not perform as well as you should have. And in as far as we are concerned, of course, you know that cancer patients are treated, they are admitted, treated, investigated at the Uganda Cancer Institute. There is a system in place for managing cancer. But our realization is that there are certain socio-economic factors that we are not focusing on that is actually of grave concern to the patients. For instance, 85% of the patients that we see at the Uganda Cancer Institute are coming from the countryside. They're coming from upcountry. And when they come from upcountry, they have to overcome a number of obstacles. The first is to kind of transport themselves and come to Kampala. And second, when you are now in Kampala, how are you going to live? How are you going to feed yourself? And moreover, they are coming because they are outpatients. They have appointment to see their doctors. And once that appointment is done, the treatment is given, they are supposed to go back home. In other words, they are not actually inpatients. So we realize that a number of patients are missing their appointments. They are actually not adhering to their treatment just simply because they cannot come to Kampala in the first place, and when they come to Kampala, there is nowhere to stay. So the best thing to do is either to delay their coming back, and when they come back, the appointment would have passed. That means actually if they were scheduled for their treatment has actually elapsed. And because of that, actually their outcome is poor, just simply because they cannot actually maintain the program that we have given them, the plan that we had drawn for their treatment. So that means both the patient and ourselves are actually losers, in the sense that we plan ourselves such that when the right time comes, we need to hit the disease. And then the patient cannot be there because of that. And as a result, the patient is not treated properly and the outcome is poor. So that is what actually drove us to think and say, is there a real big problem that we need to overcome in order to make sure that our patients adhere to their treatment? And we found out that in most cases it is just because they don't have where to stay. And the only place that they can resort to stay is at the institute, in the verandas and everywhere, which is in itself a very big risk. So that is actually the basis for us to say, wait a minute, can we do something? And about 3 or so months ago, we started actually planning to have something for a start, which eventually, given the planning and the budget that is related with it, we can actually improve on. So that is the genesis of the care home that we are talking about.
Having given us that genesis, let's understand what is this care home like and who qualifies to be in there, because what I saw is a huge tent. I saw each one finding their own ways of how they can sleep there, finding their own ways. This one is having a charcoal stove, this one. So what is the plan like? You know, these are patients then now. So how are you planning to ensure that, and who goes there? What's the more methodology of being in this tent? It's left me wondering, really, Doctor.
Yeah. So we started with a house that we have on the hill that actually currently we are not optimally using for anything. And of course, we have started refurbishing that house. And then we also thought about, if the numbers are to increase, we need to put in place somewhere where these people can cook, for instance. So we made sure we built for them a kitchen, a communal kitchen with several stoves, and then a roof over it of permanent material. And then also we constructed for them a toilet, bathroom, and place for washing. And then, of course, because of the numbers, in addition to the house, we decided that let us prepare for some temporary arrangement as well. So we did put there some tents, and the tents are the type that is used for emergency hospital. So it has everything inside, including electricity, name it, everything for a proper staying place. So that is actually the starting point with which we started. Now, regarding who qualifies to be in that home, as I told you, we are doing this to be, I would say, a stopgap for those patients who are coming from upcountry, who have no home or no place where they can actually sojourn before they come for their treatment as outpatients. So we are providing for them actually a home away from home, or at least a place where they can stay as they fulfill their appointments for review, for treatment, before they go back home. So the only people we are admitting there are people who are on appointment to see their doctors and to actually be treated as outpatients. All other patients who actually are new, are being investigated, or are actually quite ill, they have maybe side effects or complications, those are admitted in the routine ward, where if you go now, you'll find that there are also patients. So what we are trying to mitigate with this care home is actually a social problem, and this social problem is lack of accommodation when you are in Kampala. I'm very sure, I don't know whether you studied here in Kampala coming from up country in those days. When the term opens, you would actually board a bus maybe a day or so before going to the school. And when you are here in Kampala at the bus park, you kind of wonder, because if the school is opening tomorrow and you're already here in Kampala today, there's always a problem. You don't have where to stay if you don't have a relative here in Kampala. So that is the same situation where our current patients are in as far as the treatment for cancer is concerned. But more significantly, the reason why this care home is very, very important, and strategically from our point of view as caregiver, is to make sure that our patient actually fulfill the planned appointment for their treatment. Because as cancer doctors, we are battling with the disease. The disease is very clever. Actually, cancer, in as far as it's what we call replication or multiplication or whatever is concerned, follows time. Everything is timely. And our treatment is also planned in line with that timing of the disease. So now if you have planned your treatment to hit the disease at a certain point, and then your patient is supposed to be at that point,
and they can't come back for that appointment.
Come back for that, that means you have missed it. The disease is the winner. So that is why this care home is very strategic from the point of view of us as caregivers for these patients.
Well, Doctor, that well explained. I just want to remind our viewers that you can be part of the topic of discussion this lovely Wednesday morning by simply going on our social media platforms, most of our WhatsApp number, which is just on your screen, 0709 60 25 92, 0709 60 25 92. Send us a text message, send us a WhatsApp message, and I'll be reading it out regarding the care home at the Cancer Institute. We know there are so many issues that we would want to discuss when it comes to cancer, but I just want to say today we have a specific topic that we are discussing, which is the Cancer Institute opening care homes. What do you want to know about this? And I'll gladly read out the message, and of course Dr. Jackson will respond to that. But then, Doctor, one thing that rings or runs in my mind is the Uganda Cancer Institute being the center of excellency for East Africa. I have ever been at the Cancer Institute, not as a patient, but of course I have gone to visit friends that were admitted, my cousins and all that. But one of the things I've identified is not only treating people in Uganda or East Africa, even people from as far as Egypt. I've found someone from Britain. I was like, why did you choose to come to Uganda? And he told me, well, you don't know how impactful this institute is in the treatment of cancer. So I want to commend you for that. But then I noticed that it is densely populated. Getting an admission, you may come with your swag, your money, and you want, have this sort of a private room. Can I find a private room? Oh, you know what it means, doctor. They are booked. You have to wait. There is this. It is a problem. So much as we have cancer homes, doctor, I don't think this can be sustained. Why aren't we decentralizing cancer treatment? And if I'm coming from Ngulu, then why would I come to the institute? Or if I just visit the institute once, then in my area, I can continue with this treatment. What do you think of decentralizing cancer treatment? Let's take an example of HIV/AIDS. First we had Malago Tasso. You remember? And every person of HIV, Malago Tasso. Today, almost every government facility, hospital, has a specific unit for people with HIV/AIDS. Why don't we move that way?
Thank you. I think I should start with a very fundamental point that you have made. And I think this is something which is not very obvious to everybody about how significant the Uganda Cancer Institute is and how important the approach that Uganda has taken in the management of cancer is a game changer actually in the entire region. And that is the reason why we have been chosen to be the East Africa Center of Excellence. Because nowhere in East Africa, nowhere in Africa, do you find cancer care being delivered in the way that we are doing here in Uganda, where treatment is given free of charge, moreover, very high quality treatment in the hands of experts who actually know what they are doing. And all this is being done in a way which doesn't segregate between the rich and the poor. And that formula has not been actually demonstrated anywhere. Here in Uganda, cancer treatment is being given in a way which kind of provides equity to everybody. And that is why you find that there is actually no difference. And I think part of it is just simply because, unlike other diseases, where you can actually choose to say, okay, for you, we are going to treat you with a second-class treatment. You are going to give this one a first-class treatment. For cancer, it's not the case. For cancer, the treatment is the same. Whether it is for a rich person or a poor person, if the disease is named, that is it. It has to be treated using that same combination. And that is why the treatment for cancer is the same, be it in Europe, be it in America, be it in whichever place you'd want to go to. If the name of the disease is, for instance, a lymphoma, it has to be treated with protocol for lymphoma. And irrespective of whether you are in America or you are in Uganda, it's going to be the same. And that is why if you found somebody from the UK and is coming to get maybe part of his treatment with us here at the Uganda Cancer Institute.
Actually, didn't only find one or two.
Yes.
So I was wondering, for us, we know we fly our people out. Why would you? And he looked posh enough. Says, no, you just don't understand what you have here.
That is also a point. Actually, my encouragement to Ugandans is that we have all that it takes to treat the cancers here. And there is no reason why actually one should go outside. And what is now happening, which is very amazing, is that some of our people are actually going out, getting their diagnosis from there, and being told, why are you here? When actually you have good treatment in Uganda, because they know, for instance, we have one of the best equipment for treatment of cancer called True Beam Radiotherapy, LINAC, here in Uganda.
So we had a machine that had broken down.
That is now history. Actually, now we have 4 machines.
Okay.
If you came to the Institute in about a month or so, you'll find we have delivered another 4 machines. So we actually are going to be in a very good shape in as far as equipments are concerned for treatment of cancer. So my appeal to Ugandans is, before you go out of the country for treatment for cancer, please check with the Uganda Cancer Institute. We have what it takes, first of all, to identify what the problem is, and then to investigate you properly and plan for your treatment effectively. If there is really need for you to go, we can also advise that, you know, this one we don't have, then we refer you properly so that you go in the hands of experts that actually are also known to us, so that you are also referred back by them with recommendation as to how the continuation of your management should be. But right now, people are going into shops, they're getting on the line, they're getting some unknown doctor somewhere, and the next time they're on the plane, they go there, they are mistreated, and then when they come back, they now come to us. They want us to fix a problem that has been created by someone else. It cannot happen.
But also,
like
Doctor, there is a concern of too much work and few in terms of the Cancer Institute. Like I told you, when you're getting admission, just, you know, a room, the burden seems so big for you. So when you call upon many Ugandans, that's why I talked about decentralization. Whenever I got the Cancer Institute, it seems you have so much that you can chew on your plate.
I'm going to come to that. You know, all this must be planned as a system. And the decentralization that you're talking about, I'll actually come to it shortly. But the key point that I want actually to make is that all these calls for more investment in the area. What is being done now is not yet commensurate with the demand that we have. So government needs to put in more money in infrastructure, equipment, as well as, of course, training of experts. We have started training programs already here in Uganda. So that means actually that one can be ramped up so that the decentralization we are talking about, that now we have also embarked on, can also happen. We are now moving into what we call the regions. We have started by creating 4 regional cancer centers, one in Gulu, Arua, Mbale, as well as in Barara. But all these still require money. There has to be investment in as far as this is concerned, so that, you know, patients do not now have to come a long distance up to Kampala before they can get treatment for cancer. So all that is being addressed, Robert.
Well, let me now take a look at some of the messages that are coming in. Please, you can use that number on your screen, the 0709 60 25 90, to send us a WhatsApp message or a text message, and I will be reading it out, and Dr. Jackson Oliem, who is the Executive Director, Uganda Cancer Institute, will be responding to that. We are looking at cancer treatment, to be more specific, the cancer home or cancer care home that were introduced at the Cancer Institute for those outpatients, but must continue with treatment where movement or mobility could be a problem, causing their situation to deteriorate because they are not adhering to their treatment or their appointments as fixed by the doctors, because then it has a financial implication. So the Cancer Institute comes out and says, we can have some shelter for you here. But also, doctor, is this for free or do they pay?
No, it's for free. This is an extension of our service, really. We are trying to help ourselves. We are trying to help our patient. So why should we charge?
Okay. Well, I have a text message coming in here. Good morning, presenter. I'm Afeku John. My question to doctor is like this: can ulcers develop to be a cancer? Because ulcers is said as a sign of having a wound. Thanks.
Yeah, that's a good question. There are certain cancers that are caused by what we call infections, and these infections can also actually occur as a result of taking in what I would call contaminated materials in terms of our food. So for ulcers, there is a bacteria we call Helicobacter pylori that is usually actually, I would say, contaminates our foods, and then we take, and then it lodges in our stomach. Ulcers actually become cancers as well. So you are right. Cancers can be caused by, ulcers can be like a precursor to development of cancers.
Well, just to remind you, that is the number on your screen. You can send a WhatsApp message or a simple traditional SMS. Even if you don't have a smartphone, just go to your phone, send us a message on that number. I'll be reading it out for the expert we have here regarding cancer. Now, also, question coming in, one says, Tamale Jackson, doctor, you say cancer treatment is free at the Cancer Institute, but we've paid for money regarding that machine. You talked about chemotherapy, radiotherapy, and we pay a lot of money. Then another one, thanks Dr. Jackson, can recurrent abortion bring cervical cancer? Wow. Two questions, the paying and then an element of abortion here. Can recurrent abortion bring cervical cancer?
Let me start with the issue of payment. There is official payment at the Institute if you want to be a private patient. That is official, whereby you are issued with a receipt You make your payment at the bank. We have actually banks within the institute, and you go and you get your treatment. But if you don't have, you are also given treatment free of charge, as is always the norm. And in as far as quality is concerned, there is no difference between the quality of treatment given to the private patients and the general patient. So that means actually there is what we call equity in as far as our treatment is concerned.
Don't appointments then delay? Someone who is paying may be considered more of express compared to the person who is not paying.
No, actually, because these are two different tracks, but we kind of make sure that everything moves as fast as possible. And as I told you earlier, if we delay the patients, we are the loser. We should have the patients actually treated as planned without any delay. So we cannot delay our treatment. But I wanted to also allude to the fact that there are some patients who may actually be lured into making what I would call informal payment. And we want to discourage that. Our doors are open. If there is any staff at the institute who is asking you to pay outside of the system, that is actually illegal, and you should actually report it. And I do know that some patients actually fall into that. But at times also it is the patients who actually lure the health workers to kind of accept some of those payments. So I don't want to say it doesn't happen, but if it happens, it is illegal. I want to ask you to report such cases so that we can take disciplinary actions. Now, about repeated abortion causing cervical cancer, the answer is that cervical cancer is actually caused by an infection called human papilloma virus, which is sexually transmitted, and usually it is acquired much earlier in life. For instance, it can happen during the time when somebody starts indulges in sex, maybe in the teenage years, etc. But the cancer usually develops maybe after about 20 or even 30 years. So it takes a long time. So for a recurrent abortion, which happens maybe when somebody begins to get babies to kind of cause cancer, it is a bit far-fetched. So I want to tell the listener, the viewer who is asking that question, that it may not be, but of course should know what actually causes cervical cancer, so that this is very clear in his or her mind.
Okay, then we have okay. Thanks, doctor, for the wise advice, especially on cancer disease. In my occasions, many may not know they have cancer. What are some of the common causes? Thanks. That is Ogwang David Cosmas from Abim. And also, I think I'll take that with thank you for the program. I'm Conrad. To another. And then let's first handle those two. I think, yeah. It takes a long time to have treatment. And what are the signs someone can know that, yes, I think I have a cancer?
Yeah. So can cancer be spread from one person to another? No. Cancer is not a communicable disease. That is why it is lumped up with other diseases like hypertension, diabetes, etc., as non-communicable disease. In other words, cancer is not contagious. Yeah. And then the second question
signs
about the signs. Anything you feel can actually eventually be diagnosed as cancer, any symptom. So what that means is that actually routine checkup is for anything is very important. And that is what most of our people are not good at doing. But that said, they are proactively screened for cancers like that of the cervix, cancer like that of the breast, and to some extent, cancers like that of the colon, we can actually screen for them even without having symptoms. So those few cancers, we can proactively screen for them. In most cases, there are some exposure or risks that we have that make us suspect that we could be having it, that can drive us to kind of go to the health workers and specifically demand for those tests.
Then we have, good morning, Robert and Doctor. What causes delay to have cancer patients get treatment at Malago Hospital? Thanks, Bob. Gad Kaliowa.
I don't think actually there should be delay because we have a system in place. We have actually two approaches. There are those who feel like having themselves screened for cancer. We have a fully fledged screening unit for that, which is a walk-in. And then for those who are actually referred because they have already a diagnosis or a suspicion, those ones are taken through the formal system of being, first of all, admitted, and then file open and investigations done in order to confirm. Because someone upcountry may actually send you with a referral that this is cancer. And then when we review, you find out that actually they are not. Actually, we have a study which showed that up to about 40% of those diagnoses coming from upcountry to us need to be reviewed because they are actually false.
Okay, very interesting. Now there is a talk about treatment of cancer using herbal medicine. What comment? We want a comment from a doctor.
Well, as far as we are concerned, the herbal medicines, they fall under what we call alternative treatment. And usually, if they are not confirmed or proven in the laboratory to have the ingredient that are effective in the control of cancer cells, then they are not proven treatment. So those who are taking traditional medicine or herbal medicine for that matter, which has not been proven or even accredited for treating cancers, should know that actually they're just taking it as part of alternative treatment, not mainstream.
One from my very good friend here, from retired Captain Chitaka Mayanja in Chivoga. He says, I have a friend's daughter who was detected, I think, to be diagnosed with bone cancer. Is it true that it cannot be treated at your institute? Thanks for the work. He also a rejoinder to this is, one asked, can cancer be treated completely, and someone really gets cured of cancer?
I start with that one. Yes, cancer can be treated effectively. And when we say effectively, we mean actually it can be cured. And we can divide the outcome for treatment of cancer into three. A third are treated with the intention to cure. That means they can be cured. And then about a third are treated with the intention to control. That means even if you do not cure, you can give the person a long life with continuous treatment. Just like, for instance, you cannot say you can cure hypertension, but there are so many people with hypertension who are actually living for a very long time and not even dying of hypertension because they keep on taking their medication. The same is also for cancer. And then a third of cancers can actually be treated with the intention to just palliate. And that means your main aim is to improve the quality of life of the person. And that is very important, by the way, because a person may have cancer, and as you treat symptoms, you control those symptoms. The freedom from those symptoms will help the person now to continue doing whatever he or she does for livelihood, etc., without any hindrance. And that in itself is actually very good. And that is the essence why it is important to also emphasize palliative care.
Very interesting there, Doctor. Now, one says, thanks, Doctor, for the world-class treatment, but why should Ugandans still fly out of the country for treatment? Why should we go to Aga Khan Hospital in Kenya when we have the best here?
It is a question of mindset. And as I sit here and as I talk to you, we have the best equipment. Our equipment is better than the one in Aga Khan. But you'll find that Ugandans will fly to Nairobi, they go to Aga Khan, and they're treated on an inferior equipment when actually we have the best here. So it is a question of mindset. And then, of course, also we cannot force anybody to come and seek treatment with us when actually they prefer to go somewhere else.
Well, hello, how are you? I hope you are fine. But how can someone treat cancer without going to hospital? Oh, well, I think this, let me just have a rejoinder because I think what you've asked we've already answered. Now, one says, Doctor, help us really understand. When people get cancer, it's more like a death sentence. Many people lose hope when they hear they have cancer. Even relatives, some will say, that person, however much, you can just prolong life, but they will eventually die.
It is all about lack of proper understanding of actually what we are dealing with. And as I said, a cancer diagnosis should not be a death sentence. The problem is that in most cases, by the time our people get to know their diagnosis, it is already too late. You'll find that somebody has been sitting with symptoms for over 4 years, and in the 4th year, he comes and the diagnosis is made. So how do you expect now us to reverse a situation like that? So the solution is we must make sure that we consider every symptom that we have as potentially leading to a cancer diagnosis. That means we must make sure that we visit our health workers. And then also there is a problem in that in most cases the health workers also themselves, they may be a cause of the problem. Because you'll find that somebody has been going for ages to see a doctor, and the doctor has not actually figured out that this is a potential, this potentially is actually a cancer situation. And the reason for that is also simple. Our mindset, including during our training days in our universities and training institutions, has always been focused on infectious diseases. So that means by the time the doctor thinks and says, oh, after all, this is possibly cancer, it is at the end of his long list of priorities in as far as trying to come up with a diagnosis is concerned. That we can address by retraining our people, retraining our doctors, and letting them know that cancer is actually should be on the top of the list when you are looking at what we call differential diagnosis.
Well, I think I'll end with this one. Hello, presenter and doctor. I don't know how to say it, but my dad got skin punches all over his body. When he scratches his body, the punches turn pale, and after bathing, they turn black. It's all over the body. Could this be a sign of skin cancer? We have tried everywhere. How can we proceed? Let's end with that one.
I think, thank you for that. Your dad need to be evaluated. Of course, there are many other potential causes, or cancer could even be one of them. So that means you need to get your dad to a qualified doctor, and then also express your fear that potentially this can also be cancer, so that a biopsy is done of that skin lesion, and the biopsy can confirm whether it is cancer or it's not cancer.
Well, thank you so much, our viewers, for your questions. I really appreciate them. Unfortunately, there are too many given the time we have, but allow me end the questions at that. Most of them, Dr. earlier had discussed that. But Doctor, as we wind up, how can the public help in, because you talked about a temporary structure, the tent, good, but is there a way we can help regarding improving the welfare of people that are attending cancer treatment and they're using the cancer care homes?
That is a very good point. As I said at the beginning, what we are trying to address is actually a social problem. And when we have a social problem, or a socio-economic for that matter, we need to come together it is not only to be left to government alone to handle. In the case of the care home, I'm happy to inform you that actually there are a number of corporate bodies that have now come up. Some of them have donations, they have a few things. Actually, I haven't told you, some of the patients are actually asking now for food. So, you know, all those small things that can be donated or can be brought to the Uganda Cancer Institute are more than welcome, because this is a social problem and we must rally the public in order to solve it communally.
Well, I want to thank you so much, Dr. Jackson Olyem, for finding time, and of course our viewers, thank you so much for being part of this show. Anybody can suffer from cancer. The types of cancers that need screening, please go and screen. You don't have to fall sick to go to that doctor. Prevention has always been better than cure, and cancer can be treated, according to the expert. Have a lovely day. Ruben is here to take you through sports updates. See you later.
The Corporate Games Season 2022-2023 is here. Don't miss lots of fun and network.